Braces, clear aligners. Some people recognize the name Invisalign. That's a specific type or brand of clear aligners. And then there's braces. Now, most patients, when they come into my office, they don't ask me for a specific brand of braces. They just say, I want braces. When it comes to braces, the advantages of having those appliances placed on your teeth are that they're fixed into place. They're glued on for the duration of your treatment. So you don't really have to think about if it's working or not, because it is. The disadvantages, however, are the fact that you have to spend a little bit more time keeping them clean, and there's certain foods that you can't eat. So anything that's hard, crunchy, sticky, chewy, anything like that can dislodge a bracket. With clear aligners, typically they're made out of a nice smooth plastic that is customized to fit your teeth really nicely. They're comfortable. Because they're removable, you can clean your teeth just like you normally would. And there's no food restrictions, so you can eat whatever you like throughout the entire treatment. When it comes to braces or clear aligners, oftentimes patients will ask, well, Dr. Mark, what's the best option for me? And I think that that's a really great question. I don't believe that everyone is a candidate just for braces or everyone is a candidate just for clear aligners. I believe that when I speak to a patient, I want to understand what is their lifestyle like, because that will help me determine what appliance may be best suited for them. But the other thing that we have to think about is plastic can only do so much. So from a biomechanics standpoint, plastic or clear aligners may not be the best option for very difficult cases, for very difficult tooth movements. And that's the reason why sometimes I'll recommend using braces. So when you're thinking braces or the clear aligners, these are just different tools. These are different appliances that we use to move teeth. And braces, the nice thing about it is that we can increase the force levels by using different metals, different wires that are made out of different materials so that we can get predictable tooth movements. With clear aligners, unfortunately, the plastic is all uniform and that plastic can only produce a certain level of force. So I think it's really important to understand what are your goals of the treatment, because if we're trying to have very complex movements, such as moving molars a long distance, for example, to change your bite, maybe it would be better suited to go with braces than with Invisalign, clear aligners. Now, when it comes to speaking with a specialist, we have all sorts of tools in our toolbox. We have all these different appliances. I think when it comes to seeing a dentist and them offering clear aligners, especially Invisalign, you need to recognize what are the expected goals. Because sometimes with those clear aligners, if you have very complex problems, you may not be able to achieve those goals using the plastic. So just something to think about and have those conversations with your provider. And I just want to share a story too. In my practice, I have patients where I have conversations with them and we try and decide together what would be the best appliance that's suitable for them and their lifestyle. Sometimes I'll have patients that want to go with the clear aligners, and I'm fine with that. So we go with that approach, and a few months into their treatment, unfortunately, they're just not capable or able to wear those aligners the 22 hours a day that we need for us to achieve the results. So then they come back and they request that we change them over to braces. Now, I don't have patients that start in braces and switch into clear aligners. So when you're having, again, these conversations with your doctor about which appliance would be best for them, I just want you to think about this. Sometimes can be a 12 to 18 month treatment plan. And so are you capable of wearing those clear aligners 22 hours a day for the duration of the treatment? I have a lot of busy parents, I have a lot of busy patients that they don't want to have to think about wearing clear aligners all the time. They have friends and family members that have gone through the process and they prefer something that is just clearly glued onto their teeth. I have some patients coming in nowadays and they absolutely detest the fact that they would have to have braces put on their teeth. And for them to go through orthodontics to straighten their teeth out, they want to have clear aligners. So working with a doctor that has experience and understandings of lifestyle and the biomechanics, I think is really important. If you want to learn more about straightening your teeth, check out this next video.